This is a beautiful cocoa pod. And from it, we derive this magnificent set of foods. This food is rich in serotonin. It's misspelled on the slide. Serotonin. And serotonin is a neurotransmitter ostensibly links to our state of happiness. No wonder some of us could get addicted to cocoa and chocolate. And here we are in this magnificent old building that sits at the center of a cocoa estate, still functioning cocoa estate. Ladies and gentlemen, I welcome you to today's deliberation. My first task, and I do so with a little pride, is to introduce the first speaker. She's Siara. She graduated from UWI not so long ago, did her early residency in Trinidad and Tobago, and then went to the UK, where she found herself, she found her calling, she found her passion. It is with much pleasure I introduce you to Siara to give us our reason for being here today. Siara, all yours.
It is my absolute pleasure to welcome you to the inaugural event of the West Indian Society of Obstetric Medicine, WISOM. I'm delighted to welcome the Honourable Minister of Health, Mr. Terence Teelucksingh, the Director of the Directorate of Women's Health, Dr. Surujpal, the Dean of the Faculty of Medical Sciences at the UWI St. Augustine campus, Professor Hariharan Sitharaman, and I would like to welcome all our marvelous speakers who have traveled far to be here, including our keynote speaker and world expert in obstetric medicine, Professor Catherine Nelson-Piercy. This is a strongly collaborative affair that includes support from the Ministry of Health, the Directorate of Women's Health, the University of the West Indies, and the Trinidad and Tobago Medical Association. This launch is very special because it represents an important initiative to introduce the concept of obstetric medicine as a discipline to the West Indies. To our colleagues representing the various campuses in Jamaica, Barbados, and Bahamas, a special welcome to you. To our international guests joining online from various time zones in the United States, Canada, the United Kingdom, and Asia, welcome. And finally, to every one of you in this room, we are fortunate to have representation from such a wide array of participants, including obstetricians, physicians, primary care physicians, midwives, radiologists, anesthetists, pediatricians, pharmacists, professionals in perinatal mental health, lawyers, engineers, business people, and more. Thank you all for your interest in maternal health. I'd like to set the scene for why this organization was formed and why you were all invited to be here today. Let's look at some data. The maternal mortality ratio is defined as the number of deaths that occur in pregnancy or up to 6 weeks postpartum per 100,000 live births. Maternal mortality is an important measure of a country's capacity to deliver quality care to pregnant women. Looking at the latest published regional data in 2020, in Guyana, this figure is 112 per 100,000 live births. Let's compare this with Jamaica, where the figure is 99, Bahamas, 77, Barbados, 39, and Trinidad and Tobago, 27. Minister of Health, Director of Women's Health, colleagues, we have been doing well. The comparative rate for the UK in this period, around 2020, was 11 per 100,000 live births. And this image highlights the leading causes of death were actually due to medical conditions. And roughly half of them were classed as potentially avoidable. More recent data are available from last year, where the maternal mortality rate was 13 deaths per 100,000 maternities. and the causes are similar. In this case, we highlighted that inequalities and multiple disadvantage put women at even greater risk. When we examine the statistics of why women die, 60% of the cases are due to medical problems rather than obstetric reasons. These medical conditions can either pre-exist or be newly diagnosed in pregnancy. The leading causes include cardiac disease, and deaths occur due to acute coronary syndromes, arrhythmias, and heart failure, neurological disease, including stroke and epilepsy, acute respiratory distress syndrome secondary to infection, for example, COVID-19 pneumonitis or pulmonary edema, and finally, sepsis leading to multi-organ failure. When we further examine cases of where things go wrong in the UK and beyond, there are recurring themes, pitfalls that must be addressed, and include clinicians not being able to differentiate normal physiologic changes from pathological events in pregnancy, clinicians dismissing or not recognizing red flag symptoms, lack of timely investigation, focusing on excluding a diagnosis rather than actually making a diagnosis, not offering treatment, not seeking expert or multidisciplinary opinions, and overall, these factors lead to clinical inertia, delays, and potentially avoidable adverse outcomes. I believe the effective rollout of obstetric medicine in this setting will be key to us making further progress. I would like to share our vision with you. WISOM is a non-profit organization established to expand obstetric medicine expertise in the West Indies. Our mission is to improve recognition and treatment of medical problems in pregnancy with a view to prevent avoidable maternal mortality and morbidity. Our goals would be to introduce and sensitize clinicians to the concept of obstetric medicine as a hybrid specialty, and to set and maintain standards of evidence-based best practice. Finally, an important role is for us to advocate for fair and equitable management of women with medical problems in pregnancy. Your input will be highly valued, and we look forward to your contribution in shaping and molding our work together. We have put together a very exciting program which I know you're looking forward to. So without further ado, let's hear from our wonderful speakers, and I look forward to your ideas and deliberations. Thank you.